Imagine this for a moment. It's late at night. Your house is quiet. You're sitting alone, maybe watching TV, maybe getting ready for bed. Suddenly, there's a strange pressure in your chest. Not sharp pain, just a heavy, uncomfortable squeeze. You tell yourself it's probably nothing, maybe indigestion. But deep down, something feels wrong. Your phone is across the room. No one is with you. And a terrifying thought flashes through your mind. What if this is a heart attack, and I'm completely alone? If you're over 60, this is not a rare situation. It happens every single day. And the difference between surviving and not surviving often comes down to a few critical minutes. And a few simple actions most people are never taught. Today, you are going to learn exactly what to do if a heart attack strikes when no one else is around. Let's start with an uncomfortable truth that most seniors never hear clearly enough. Heart attacks after 60 often do not look like the dramatic scenes you see in movies. There's not always a sudden collapse or crushing pain. In fact, many older adults experience subtle, confusing symptoms that are easy to ignore until it's too late. After 60, the heart and nervous system don't always send loud warning signals. Instead, the body whispers. You might feel pressure instead of pain, tightness instead of stabbing. You might feel tired, short of breath, slightly dizzy, or nauseous. Some people feel pain in the jaw, neck, shoulder, upper back, or left arm. Others feel an unexplained sense of anxiety or doom, like something is deeply wrong but hard to describe. This is why the first and most critical tip is this. The moment something feels off in your chest or upper body, especially if it lasts more than a few minutes, you must take it seriously. Do not wait for intense pain. Do not wait to see if it goes away. Waiting is one of the biggest reasons heart attacks become fatal when someone is alone. Here's what actually happens during a heart attack. A blood vessel supplying your heart muscle becomes blocked. Oxygen can't reach part of the heart. Every minute that passes, heart cells begin to die. The longer you wait, the more damage occurs, and the harder it is to survive, even if help arrives later. Time is not just important. Time is everything. So the second critical tip is this. Sit down immediately and stop all activity. Do not try to walk it off. Do not lie flat, sit upright or slightly reclined. This reduces the heart's workload and helps maintain blood flow to vital organs. If you are standing when symptoms start, sit down right away to prevent fainting or falling, which can make things far worse when you're alone. Now, this next part may save your life, and it's something every senior should decide before an emergency ever happens. If you have been prescribed aspirin by your doctor, or if your doctor has told you it's safe for you, chew 1 regular strength aspirin, usually 325 milligrams, or 2 low-dose aspirins. Chewing is important because it helps the medicine work faster. Aspirin helps prevent blood clots from getting bigger. It does not stop a heart attack, but it can slow the damage while you wait for help. However, this is extremely important. If your doctor has told you not to take aspirin, or if you have a known allergy or bleeding condition, do not take it. This is why having this conversation with your doctor before an emergency matters so much. Now we come to the step that many people hesitate on, and that hesitation costs lives. Call emergency services immediately. Do not drive yourself. Do not wait to see if symptoms improve. Do not call a neighbor first. Emergency responders can begin treatment the moment they reach you, and they can alert the hospital to prepare life-saving care before you arrive. If you're thinking, what if I'm wrong? What if it's a false alarm? Remember this. Doctors would much rather see you for a false alarm than too late for a real heart attack. There is no embarrassment in calling for help. There is only survival. If using a phone feels difficult because of pain, weakness, or panic, put the phone on speaker. Speak slowly and clearly. Tell them your age, your symptoms, and that you are alone. If you have a medical alert device, use it immediately. These systems exist for a reason, and this is exactly the situation they are meant for. Now, while you are waiting for help to arrive, your job is to stay as calm as possible. Panic increases heart rate and blood pressure, which puts even more strain on an already struggling heart. Slow, steady breathing can make a real difference. Breathe in through your nose for about 4 seconds, then gently out through your mouth for about 6 seconds. You're not trying to be perfect, Just steady. At this point, many people wonder about coughing or other techniques they've heard about online. This is where things get dangerous. Forceful coughing is not a reliable or recommended way to stop a heart attack when you alone, and attempting it can delay real treatment. The safest actions are staying seated, staying calm, and waiting for emergency care while following professional guidance. Before we go further, I want you to understand something deeply important. Surviving a heart attack alone after 60 is not about being strong or tough. It's about being prepared and acting early. The body gives you a window of opportunity, but only if you recognize it and respond correctly. In the next part, we are going to talk about what to do before a heart attack ever happens to dramatically increase your chances of survival, including how to prepare your home, your phone, and your body in ways that most seniors never think about. We'll also cover a few dangerous myths that sound helpful but can actually make things worse if you were alone during an emergency. Now let us talk about what can quietly increase your chances of surviving a heart attack before one ever happens, especially if you live alone or spend long hours by yourself. These steps may seem simple, but together they can mean the difference between help arriving in time or not at all. One of the most overlooked survival tools after 60 is your phone, not the apps, not the internet, the emergency features built into it. Many seniors carry a phone every day but don't realize it can call emergency services even if the screen is locked or even if you're too weak to dial normally. Take a moment, today, not later, to learn how your phone's emergency call feature works. Set up emergency contacts so responders can reach family quickly. Some phones even allow you to share medical information like heart conditions, medications, and allergies directly from the lock screen. In a crisis, this saves precious minutes. Another critical preparation step is keeping a visible written list of your medical information in your home. Medications, dosages, allergies, heart conditions, past surgeries. Keep it somewhere obvious like on the refrigerator or near your front door. Emergency responders are trained to look for this. When you're alone and unable to speak clearly, that piece of paper can speak for you. Now, let us address a dangerous myth that spreads fear and confusion among older adults. If I lie down and rest, it will pass. This belief has cost many lives. Lying flat can worsen breathing and reduce circulation during a heart attack. Sitting upright is far safer. Another myth is, I should wait and see if the pain gets worse. By the time pain becomes unbearable, significant heart damage may already be happening. Early action is not overreacting. It's intelligent self-care. There's also the belief that heart attacks always come suddenly and violently. In reality, many seniors experience warning signs hours or even days before a major event. Mild chest pressure, unusual fatigue, shortness of breath while doing simple tasks, trouble sleeping because of discomfort. If you notice these changes, especially if they're new or worsening, do not ignore them. Call your doctor or seek care immediately. Catching a heart problem early can prevent a full-blown emergency when you're alone. Now let's talk about something that's uncomfortable but extremely important. Pride. Many people over 60 hesitate to ask for help because they don't want to feel dependent. They don't want to bother anyone. But surviving a heart attack alone is not about independence. It is about staying alive long enough to remain independent. Wearing a medical alert device, keeping your phone nearby, or checking in daily with someone you trust is not weakness. It's wisdom. Another powerful step is understanding your personal risk. If you have high blood pressure, diabetes, high cholesterol, a history of smoking, or a family history of heart disease, your risk is higher. That doesn't mean a heart attack is inevitable, but it does mean preparation matters even more. Talk to your doctor about warning signs specific to you and ask directly, what should I do if I have chest symptoms and I'm alone? That conversation alone can save your life. Let's also talk about what not to do while waiting for help. Do not eat or drink anything except aspirin if advised. Do not take random medications hoping they'll help. Do not search the internet for solutions while delaying emergency care. And absolutely do not attempt to drive yourself to the hospital. Heart rhythm disturbances can happen suddenly, and losing consciousness behind the wheel puts you and others at serious risk. As help is on the way, Unlock your door if you safely can. Turn on a light at night. Sit where responders can easily reach you. These small actions reduce delays once emergency services arrive, and seconds truly matter during a cardiac event. Here is something many people do not realize. Survival rates are much higher for people who call emergency services early, even if symptoms turn out to be less severe than feared. Early care means oxygen, monitoring, medications, and rapid transport to a hospital that's ready for you. Waiting alone at home does the opposite. In the final part, we are going to cover the last critical tips every senior must know: how emotional stress affects the heart during an attack, what family members should be told ahead of time, and how to create a simple, personal survival plan that gives you peace of mind without fear. Now let us talk about the final, often ignored piece of surviving a heart attack alone after 60, the role your mind and emotions play in those critical moments, and how a simple personal plan can protect you when fear tries to take over. When a heart attack begins, the body releases stress hormones almost instantly. This is a survival response, but in older adults, it can work against you. Stress hormones raise heart rate and blood pressure, forcing the heart to work harder at the exact moment it needs rest. That's why emotional panic can worsen damage. This doesn't mean you can simply stay calm on command. But it does mean that having a plan reduces fear automatically. If you already know what to do, your brain doesn't have to guess. It follows steps. Sit down. Call emergency services. Take aspirin if approved. Breathe slowly. Unlock the door. This mental checklist lowers panic and protects your heart. That's why one of the most powerful survival tools is something you prepare now, not during the emergency. A simple heart emergency plan. Nothing complicated. Just a few clear steps written down and reviewed occasionally. Knowing that plan exists brings peace of mind, and peace of mind reduces dangerous hesitation. Another key factor many seniors don't consider is emotional stress in daily life. Long-term loneliness, grief, anger, and chronic anxiety all increase heart strain over time. Living alone doesn't just increase the risk of being alone during an emergency. It can also quietly increase the risk of the emergency itself. Staying socially connected, even through brief phone calls or regular check-ins, is not just good for mental health, it's protective for your heart. Now let's talk about family and friends. Many heart attack survivors say the hardest part wasn't the pain. It was that no one knew what was happening. Tell at least one trusted person about your heart risks, your medications, and what you want done in an emergency. Make sure they know where you keep your medical information. This isn't being dramatic, it's being prepared. If you live alone, consider daily routines that create safety without fear. Keep your phone charged and nearby, even when sleeping. Avoid locking doors in a way that prevents emergency entry. Check in with someone regularly. These habits quietly increase survival odds without affecting your independence. There's also something important to understand about recovery. Surviving a heart attack is not just about the first hour, it's about what happens after. The sooner treatment begins, the more heart muscle is saved. That means better recovery, more energy, and a higher chance of continuing an active, independent life. Acting early doesn't just save your life, it protects the life you want to keep living. Let's bring this all together. After 60, heart attacks don't always shout, they whisper. Survival depends on listening early, acting fast, and removing hesitation. Sitting down instead of pushing through, calling for help instead of waiting, preparing in advance instead of hoping it never happens. You don't need medical training, you don't need to live in fear. You just need knowledge and a few decisions made ahead of time. You have now learned the most critical steps every senior should know about surviving a heart attack alone. The final piece is bringing this message home in a clear, empowering way that helps people remember and act. If there's one message to carry with you from everything you've heard today, let it be this. Surviving a heart attack after 60 is not about luck. It is about recognizing the moment and acting without delay. Your body will usually give you a signal. It may be subtle, it may feel confusing. But that quiet pressure, that sudden breathlessness, that unexplained fear is your heart asking for attention. Listening early can save your life. Being alone does not mean being helpless. When you know what to do, When you've already decided how you all respond, fear loses its power. Sitting upright, calling emergency services immediately, taking aspirin if your doctor has approved it, breathing calmly, and making your home easy for responders to enter are simple actions, but together they are powerful. They buy you time, and time protects your heart. Preparation is not about expecting the worst. It's about protecting the life you've worked hard to build. Keep your phone close. Set up emergency features. Share your plan with someone you trust. These small choices give you confidence and control, not anxiety. And remember this: asking for help is not weakness, it is strength. Every emergency call made early gives doctors a chance to save heart muscle, preserve independence, and give you more healthy years ahead. If this information could help someone you love, a parent, a spouse, a friend, share it with them. Knowledge spreads safety, and the more people who understand these steps, the more lives can be saved. Your heart has carried you through decades of life. Knowing how to protect it, even when you're alone, is one of the most important gifts you can give yourself.